explicit declarative learning and non-declarative or implicit learning is, for declarative learning, you need full attention. You need full attention. For example, you are reading some books, you should have full attention to understand what you are reading. And when you are giving some skills to your patient, if you need full attention of the patient, it is some types of explicit. But giving some skills, but you don't need complete attention, this is some types of implicit and non-declarative. These are something that you can think how you can use such these learning procedures for your patients. Because any improvement in cognitive skills is some types of learning, some types of skills. But let me tell you what is conditioning. Anybody can explain what is conditioning? Do you know Pavlov's dog? What is conditioning? And these types of conditioning and priming affects on your behaviors. Let me tell you. In other classes, I don't explain these things, but because you should be a very cognitive scientist, you should learn it, because it is a little difficult to understand. What is conditioning? The example of conditioning is with Pavlov's dog. What did Pavlov's dog is what? For example, the sound of the food come. And the dog is like that. And this sound come. The dog is like that. It means nothing, no reaction. It means that this stimulus is ignored in conditioning. That some stimulus has no response. See? You hear something, you see something, but he did that. Whenever these sounds come, he gives some food to him. After 3 to 4 times, whenever the dogs hear this, he see what happened? That you convert some stimulus that there was no response, you make it response. We call it condition. You know, sometimes some such conditioning happens and you are not aware of that. You are not aware of that. Like some sounds all the time, whenever, for a while, when we were on call during residency, you know that. Do you know what is on call? It means that anytime they call you, you should go to hospital, for example, or something like that. It's better to talk about in priming. Because in real life, finding such these examples, we should think about that. That sometimes you don't have any reaction to some stimulus, but because of something that happens during time, you respond to that. Oh, let me give you an example. Now I have reached to this example. You know that in Tehran, we had a lot of explosion happen. And my colleagues, when they were here, it is very, very, very interesting. And it also happened to me that our professors, even any knocking of the door, before this strike, they had no reaction. But now, even the sound like that, they were like that. Suddenly they look at what happened. They are completely unaware. And you know that the day before yesterday, I went to a majlis that the cooler was on and it was, it was swimming, the cooler. And when the wind of the cooler goes to the microphone, it was like that. Before this event, I didn't pay attention to this sound, but you cannot believe that. All the time I thought that this is the sound of the planes, missiles. All the time. See, this is conditioning. That before something that happened, you didn't give any response, you ignored. You know Dr. Rashan?
Yes.
It was about Dr. Rashan, I heard that.
Yeah.
That any sound like that, he was like that. Exactly, you can see in his face. This is conditioning. But you know that for you, any of such this sound, you don't pay attention to that. This is conditioning. Conditioning means you give some response to the stimuli which you ignored before. And with this Pavlov dog, whenever he hears this sound, because he expects that this is the sound of food, he immediately makes reaction and his saliva starts secretion. This is conditioning. Understand? We call it conditioning. And conditioning is mostly located in cerebellum and also amygdala, because most of the time these are emotional conditioning. Emotional conditioning is exactly what I mentioned. But in emotional conditioning, most of the time you react emotionally. But in skeletal conditioning, you give some movement. You have some movement, like the dog. Like the dog even starts, walking, standing up, waiting, and also emotion. So how it happens? Did, for example, I myself try to record this, and how I can explain that? It is some implicit, non-declarative, but it is recorded in your mind. Some emotions, some events, but not in hippocampus, in emotional memory. And okay, this sound is similar to the sounds of the missiles. This sound is similar of the explosions. This is conditioning. But what is priming? Priming is something else. What is priming? Who can tell me? Did you understand conditioning?
Yes.
Some stimulus, you didn't respond, but now you respond to them. Priming is some stimulus, you respond to that, but it is changed. With something, the response to that stimulus is changed. Priming is much more prevalent. Can you give me some examples about priming? For example, some persons, miskin, come and ask you money. And you bring the alif dinar to give him. But you understand that, wow, this person is much more richer than me, and you get money. You lose your trust. It changes your response. Even if some real miskin come to you, you don't give any money to him.
Yes.
Priming is very prevalent. See, sometimes you trust, for example, to somebody, but some events happens that you lose your trust. And anything happens, your reaction, your response to this situation is different from before. Understand? This is priming. And this priming is very, very higher function in neocortex. So, priming is special to human. Conditioning is low level function. All the animals could be trained by this conditioning. You know, conditioning is the way how you train the animals. Have you seen that, for example, some animals you can train them to do some special movements, and it is very attractive. How you change their behavior? Using cerebellum. You have seen that some animals walk on their just foot. How we can teach them? By conditioning, by working on cerebellum with some gifts, with some rewards you give them, they learn. For example, when you put some sound in normal situation, they don't react. But when they understand that these sounds come, they stand like that, they will get reward. It is conditioning. Exactly, also in the child, in the children. But these types of behavior and emotional conditioning happens also in animals. You know that in Tehran, this is very famous, that a lot of animals died because of these explosions. You know, these are conditioning. A lot of cats, a lot of dogs, a lot of birds died because of such these explosive sounds. This is conditioning. But priming is high level function of cortex. So be careful that if your friends lose their trust to you, priming happens. In somewhere when you need your friends, they do anything they can, but if they lose their trust to you, they do nothing. This is priming. They change their behavior. And you should know that priming is the very, very, but you cannot express yourself even inside yourself. Why I am doing that? I love to do that, but I don't. Priming, and it is in neocortex. And again, sensitization, habituation, these are something that, again, these are not expressive like informations and events, but affects on your behavior, affects on your personality, affects on your behavioral pattern. So, most of the time, you use your hippocampus for studying anything happens around you, your experiences. But non-declarative information also has very important role in your performance, in your behavioral pattern. So, hippocampus in temporal lobe is responsible for declarative memory. It means that recording explicit information. But we have other parts which has role in recording implicit information, non-declarative information. Your attention is not fully involved on that. It is not necessary. You know that one of the strategies for teaching of the students from the teacher is role modeling. You cannot imagine that sometimes some of the behaviors you see in you, the professor, indirectly affects on your behaviors. This is a non-declarative. Even you are not aware of that. You as a doctor should be a role model of your society. You should be able to change the behavior and the reaction of the society in a special situation. You know that we have a word, we call it charisma. Do you know what is charisma? How you can affect on the others. And your behavior, your habits, your manner, you learn it. But it's not necessary to full attention. What I am telling you are some facts. You should have fully attention to what I am talking about. But to my behavior, to my manner, this is some types of situational or, you know, something that indirectly, unconsciously, and implicitly is affecting on your behavior. And I think it could be some types of priming happens. Priming, change the behavior. You can control yourself in some situations. This is priming. So, in my opinion, role modeling, what the behavior, the posture, the manner of speaking, how affects on the students is some types of priming. And this is one of the most important manners of learning. Okay.
Doctor, sorry, before entering language, I have a question. Can you give us some exercise that we use while studying to improve our memory?
Yes. How to improve your memory, how you can improve the skill of recording information and retrieving it. Yes, we have some very, very simple. Maybe you say that, oh, every time I ask anybody, just tell them. But honestly, most of the time, by paying attention to such these very easy strategies, we can improve your memory. Because the capacity of memory has no limitation. No limitation. When I say no limitation, it means no limitation. Any events, any facts, anything you can record. But why you can retrieve it when you need? Why during the examination you forget? There are something that interfere with normal functioning of, for example, memory and learning networks. The most important is anxiety and stress. How anxiety and stress stop memory networks from working normally? Because they send some signals and disturb your attention. And when you have disturbance in attention, you cannot memorize, you cannot record. The most important strategy for empowering the memory and learning skills is decreasing anxiety. All the time I say this sentence, that your mental health, your calmness, your relaxation, your good feeling is the most important part of our task. If you are in a stressful situation, for sure this anxiety decreases your attention, so you cannot memorize, you cannot learn. So, the first strategy, you should try to upgrade your attention. And for upgrading attention, first, you should try to decrease your anxiety and stress. And how you can decrease your anxiety and stress? I myself have a course about management of anxiety. This is around 20 hours. And I cannot honestly, 20 hours means 2 credits.
Yes.
But one of the most, useful strategies for decreasing the anxiety, we call it mindfulness. What is mindfulness? Mindfulness is you be aware about your feelings and emotions. Okay, what is the benefit? Very beneficial. If you know that you are anxious, if you know that you have stressful thoughts, even knowing, being aware of that, you can control it better. Mindfulness, that has level A for effectiveness in the treatment of anxiety. Level A, level A, it means that very effective, very effective. How you do mindfulness? 20 minutes per day in a period of time that you don't have any job after that, because you should not be in a hurry. 20 minutes in a period of day that after that you don't have any task. It doesn't mean that till the end of the day you don't have task. I mean that in this 20 days you should not be in a hurry. You should be completely relaxed. In some places with good weather, call 20 minutes. Walk slowly and think about yourself. Think about your mind. Try it. Try it. Because everybody said that, okay, what is the benefit? Try it and you will see. Level A in the treatment of anxiety. Mindfulness. And you know that mindfulness has level A in recovery of lung after COVID. After COVID-19, any destruction in the lung, mindfulness has level A for post-COVID lung destruction recovery. Level A means very, very effectiveness, evidence-based. It is approved. So, just by thinking about your mind, oh wow, stressful you are. Today I have a lot of bad feeling. All the time I was anxious. I am very sad now. I am very hopeless now. I don't have any hope now. I cannot enjoy anything. Just talking with your mind. Try it. Believe me that it is much more effective than you talk with somebody as, for example, sharing your feelings and emotions. Although nothing changed, but when you are aware of what is happening in your mind, makes you more relaxed. Try it for 2 weeks. 20 minutes, walking alone, and you should not have any job after that. Because sometimes you feel that, okay, I am enjoying, I am talking with myself. Me and my mind are the best friends together. Try to solve your problems. The next step, your attention will increase, and the next step, your memory. This is one of the most effective strategies for improvement of memory and learning. Try it. Daily 20 minutes. You and yourself be alone. Try it, and if it was effective, we will give you another task, the next task. Honestly, I wanted to give you some in the corridors. I wanted to put some games in the TVs, the smart TVs in each floor, that put some games that, for example, some games that improve your attention. Some games improves your memory. Some games improves your learning skills. Some games improve your executive function. With some games, it is very, very also beneficial. The next part of cognition is language. Language, because language is specified for a speech therapist. The speech therapist students I just say very in summary about language. You know, we have a very important skill. We call it communication. And one of the arts of a doctor should have good communication skills. You should be able to communicate with your family better than the others. Communicate with your friends better than the others. And you also should be able to communicate with your patients. Very important. How to communicate with your patients? Because making a professional relationship with the patient is enough for treatment if you make good relationship with the patient. And communication is, whenever we talk about communication, because you should learn what is communication, but not in very complex details. What time it is? Okay, just less than 10 minutes, I think. No problem. Whenever we talk about communication, communication is sending a message through a channel from sender to receiver, and then receiver change another message, but now it will be sender, then it is receiver. So this is communication. If whenever we talk about communication, communication has four parts. A message sent through a channel by a sender and received by a receiver. Any communication has four components. What types of message do we have? What you send as a message? Thoughts, very good. What else?
Opinions, ideas.
Opinions, ideas. What else?
الإشارة شنو الإشارة؟ signal.
Signals. This is emotions, for example, feelings. What else? Facts. Knowledge. What else? Experience. What else? Complaints. Needs. But if we want to categorize these messages, what types of messages do we have? We call it verbal, non. What is verbal? In verbal, for transferring your message, including ideas, opinions, knowledge, signals, as you mentioned, emotions, feelings, needs, grievance, complaints, you use word. When you use word for this message transmission, we call it verbal communication. But when you don't use word for transferring the message, we call it non-verbal communication. So, communication is two types. Verbal, you use word. Non-verbal, you don't use word. Can you give me some example that you transfer your thought, opinion, emotions, feelings, needs? for non-verbal communication. Hmm? Jim? Facial expression. Very good.
Yes.
What else? Hmm? Body language, very good. What else?
Sounds.
Sounds like what?
Like
Yes, very good. In children,
yes.
what? Crying, shouting. Hmm?
Physical.
And eye is very important channel for transferring the expression, the feeling and emotion. Eye. Eye is very, very strong for sending messages. Be careful. Yeah. So, we have a problem in Persian. I don't know that you have also. I never lies. You know, the tongue lie. Especially my eye is very, very. I don't know. Never I can cheat anyone. And it makes a lot of problem for me. That anytime I want to tell lie, but my eye is, that's why all the time I try not to look at the other's eye. But again, it shows that I'm telling